So a lot of patients have concerns about participating in clinical trials. They have a lot of misperceptions about clinical trials. And I reassure my patients that I'm offering it to them as an opportunity for them to help us to determine the best way to treat cancer.
To me, to have the opportunity to go on a clinical trial for a patient is incredibly exciting.
I did not do this for any altruistic reason. I really felt the best option was to participate in clinical trials.
I think it's always important to consider the option of a clinical trial when a patient and her physician are having a discussion about the alternatives.
The way I explain clinical trials to my patients, I tell them it's an opportunity for them to volunteer to help us learn about innovations in cancer care.
We also recognize that an investigational agent is just that. It's not proven, and we don't know everything that we would eventually want to know about the safety of that investigational agent. The other thing that I think is really important for patients who participate in clinical trials is that they often get a really good level of care because they're being very carefully monitored, evaluated, and basically cared for throughout the clinical trial. Now, having said that, a clinical trial, again, is a test, and there are no guarantees that we will really see superiority.
When we do clinical trials that are looking at drugs treating serious diseases like cancer, we rarely use placebos.
The clinical trials that use placebo are doing it when there's no effective treatment at all, so you want to see if this new treatment is working.
In most of our double-blind randomized trials, especially treatment trials, both sides get standard of care. One side gets the research drug with standard of care, the other side gets placebo with standard of care.
And so the highest level of evidence is if you've had multiple randomized clinical trials that demonstrate the superiority of a given treatment, which then becomes the standard of care.
So in my case, I knew that I was expected to receive chemotherapy and radiation. That would have been the standard of care. Had I declined the clinical trial, I would have still received, as my doctor referred to it, the gold standard, which was standard of care.
The standard of care is good in many circumstances, and it's the standard for now, but we're always trying to improve.
So there's this feeling that clinical trials are a last resort, and they aren't. I've participated in many clinical trials over the years because there are no proven treatment options. We're still exploring what is the best option for this cancer.
Most of the time we are studying something that we think is probably better than the standard of care, but there's no guarantee that that's going to be the outcome.
One of the main reasons I did clinical trials was for my daughters and my granddaughter.
My participation in a clinical trial I knew was also very important because what was presented to me as standard treatment, I recognized at one time had been experimental. So I knew that by me participating in this experimental drug treatment, the best thing that could happen was that it was going to benefit me personally. But I also knew even if there was negative outcomes, that that was going to be very valuable data to the researchers and the medical community. So I knew that it was for me, but it was also for something much greater. And it is something that I am very happy to have done.
If we're going to find the answers, it has to be because we're all willing to step up and be part of the research and part of the studies, even when we're scared to death.